Hello, everyone. Thank you so much for being here today with us, and welcome to the 15th episode of the Insight webinar, a public health webinar series hosted by eHealth Africa. The webinar series enables insightful conversation with public health professionals. My name is Mohammed Fauci Adeniran. I am a project manager with eHealth Africa. I'll be your moderator for today's conversation, and I am excited to be here today. My favorite part of this session is getting to learn from professionals in the field of public health and supply chain. Today's webinar will be 1 hour length, and that includes time for Q&A session. So, if you have any question, be sure to drop them in the Q&A section below. Please use the Q&A section. We'll try to cover as much as we can at the end of our conversation. Also, if you need to hop off early, don't worry. This webinar is being recorded, and you can always catch up later. You can find the recordings on our website, www.ehealthafrica.org/insights, or on our YouTube channel, youtube.com/@ehealthafrica.org/videos. Of course, after the webinar has ended. For the audience, we would like to know where you're joining us from. Please state it in the chat box. Kindly introduce yourself by typing in your location, your name, which organization you work for, and your role within the organization. To give us our welcome address, please welcome our Deputy Director of Programs, in person of Dr. David Ackman, to give us the opening remark and welcome address. Dr. David Ackman, thank you for being here with us. Over to you, please.
Thank you, Fauzi. I hope I'm audible enough. Can you hear me?
Yeah, we can hear you now.
All right, fantastic. Thanks so much. I think I will keep my video out for now. So welcome everyone to this particular episode of Insight, and we're excited here to be discussing one of the very great topics, right, in our series around how we could promote public-private partnership to improve last mile vaccine delivery. We know that why this topic is important is looking at sustainable mechanisms or innovations in terms of how we can achieve vaccine last mile delivery. So that's very important. And to also understand that some of these innovations are not rocket science. They are not difficult to have or difficult to implement ideas. And that's why we've been able to pull together great panelists who will share insights at this platform for us to learn and adapt some of these innovations into different settings and contexts. So we look forward to the conversation, and that's well captured by Fauzi. Please be very open to sharing even your own ideas or insights, and as well ask questions, and we're sure our great panelists will be able to respond to them. Yeah, so happy to have everybody here. Thank you.
Thank you very much, Dr. David, for that warm welcome address. Our panelists, this conversation wouldn't be happening without you. Thank you for your willingness to share your knowledge. Our panelists today are seasoned public health professionals with wealth of experience in last mile delivery of life-saving vaccines and medicines. They are top leaders in public health logistics and knowledgeable in public-private partnership. In no particular order, I will introduce our panelists for today, starting with Dr. Abiodun Oyenuga. Dr. Abiodun Oyenuga is the lead BMGF strategic support to targeted Nigerian states to improve supply chain performance. He is an accomplished medical doctor with over 12 years of dynamic experience in health system strengthening. He is a trailblazer in shaping the future of public health supply chain in Nigeria. With a distinguished career encompassing health insurance, financing, and quality improvement, he combines his medical expertise with an MBA in sustainability from Nextford University and his certification as a supply chain analyst. His remarkable journey includes mastering supply chain micromaster courses from MIT, which ignited his passion for resilient supply chains. Dr. Oyenuga leads a transformative project, propelling strategic improvements in Nigeria's public health supply chain. As an advocate for public-private partnership, he orchestrates innovative models, bolstering last-mile delivery of health essentials. His vision encapsulates uniting public and private sector, redefining Africa's health logistics landscape with a resounding impact. Please join me in welcoming Dr. Abiodun Oyenuga.
Thank you so much. It's a pleasure to be here.
Thank you, Doctor. Our next panelist is pharmacist Doreen Enejo. She is the country program lead for USAID MTAPs. USAID MTAPs. MTAPs means medicines, technologies, and pharmaceutical services. She is a trained pharmacist with over 24 years experience across public sector, private sector, international NGOs, and holds a postgraduate diploma in global health procurement and supply chain management, as well as a master's degree in public health management. Please join me in welcoming pharmacist Doreen Enejo.
Thank you for having me here. It's a pleasure being here. Thank you.
You're welcome. Our last panelist will be joining us soon. He is no other person than pharmacist Timileyin Omole. Pharmacist Timileyin Omole is a passionate believer that we can individually reiterate our individual excellence until we collectively evolve a majestic world for the good of humanity and to the glory of God. He is a trained pharmacist and a supply chain professional from the University of Jos, Nigeria, and University of Roehampton, United Kingdom. Combining his passion, skill, training, and expertise, he has been about his purpose of advancing healthcare across the globe. His experiences have been through different international organizations and governments of Nigeria in the public health and supply chain space. He has also had experience in sales and marketing. He has practiced pharmaceuticals itself and also done research and development. He's an expert in health supply chain. Pharmacist Timi is currently the executive director of the International Association of Public Health Logisticians, IAPHL, a community I also belong with. A community of practice of public health and humanitarian supply chain professionals across the globe. Pharmacist Timi loves to spend time with his family, reads, travel, and plays tennis. Please join me in welcoming pharmacist Timileyin Omole. To set the background, today we'll be discussing about promoting public-private partnership in improving last-mile vaccine delivery. I'll start with a quote from African Resource Center of Supply Chain, which says, nearly half of all patients cannot access medicines and health products they need in the right quantities and at the right point of need, which are the important rights of supply chain. The African public health system has a huge challenge that affects over 1.3 billion people. Many patients cannot access medicines they need, but from the private sector, they can access toothpaste, cool drinks, even SIM cards. This is because many private sector supply chains are complex, yet efficient. On the other hand, public sector supply chains are often complex, inefficient, and fragmented. Nonetheless, we've had progress and efforts to improve the vaccine supply chain through public-private partnership, which has yielded tremendous results over the years. An example will be the Sokoto State Primary Healthcare Development Agency and eHealth Africa through the Sokoto State BMGF Dangote Foundation Basket Fund MOU. Despite this project, the progress made so far, public-private partnership in health sector has its own unique challenges and limitations. Not for long, I hope, because today we'll be discussing the challenges that have hindered the scaling up of this partnership, its impact on vaccine delivery, especially to the remote areas, and our panelists will provide practical recommendations to improve such collaborations. I'll go into the question. And I think the first question will be for Dr. Abiodun. Citing some examples of successful public-private partnership in Nigeria in the delivery of vaccines in low-income countries to combat diseases like polio. We can talk about the GPEI, that's the Global Polio Eradication Initiative, where you have the WHO, CDC, Rotary, UNICEF, BMGF, Gavi, and the Ministry of Health of those countries. In the Nigerian context, are there examples available locally within Nigeria? Over to you, Dr. Abiodun, if you can shed more light on that. Do you have examples?
Absolutely. Thank you so much again for that kind introduction. I'm truly honored to be here as a panelist for this important webinar. And of course, I hope that the insights that we share today will provide valuable perspectives on this topic. That said, yes, there are quite a number of private sector partnerships with the public sector that we have seen with results with, that we're looking at scaling, absolutely. So, I mean, it would be safe for me to start with the PPP, midwifed by the Africa Resource Center for Excellence in Supply Chain Management, ACESM for short. That's quite a mouthful, right? And so when we started out, I mean, the clamor has been to make sure that there's access to essential life-saving medications, good quality, affordable, and then of course ensure that they are available easily across the state. So one of the things we did was to approach the local pharmaceutical companies. And this is strategic in the sense that we've kind of thought about the fact if we improve local manufacturing capacity, then we will, one, ensure drug safety. Secondly, increase job availability, because of course, with increased demand, there will also be an increase, in need for employment. And so this partnership was midwifed by ACESM between the local pharmaceutical companies in Nigeria. Those 10 states that this project supports, and then the local pharmaceutical companies. And the idea is to also, beyond the transactional level, which is sales, purchase, and supplies, also leverage the expertise of the supply chain for these local farmers to further drive the efficiency of the public health supply chain. What this has done is it's also giving some insight into the kind of demand data in the public health sector. So the companies are more open into innovation, research, and development. Some of them are beginning to expand into, we are looking into the development of vaccines in country, which was expected to, of course, improve the availability of vaccines locally. We can also take a quick look at Zipline, the Zipline partnership with Kaduna State, where they're using drones to expand their coverage and deliver life-saving medicines and vaccines to remote areas in Kaduna State. There's also the Life Bank BOET Foundation partnership, which also was midwifed by the RKSM to support fleet management at, these states, Yobe State and Kaduna State especially. And recently, there's a project called One Box Project, where they are supporting the states with last mile delivery, to ensure, and then they're also doing this with the deployment of infrastructure and assets that will assist with optimizing inventory at the last mile. We also, over the years, Riders for Health has been in the health space for quite a while now, and working in country with governments, national and states, providing assets and expertise to enhance health commodity logistics. I think the final one will be GRISIT. GRISIT has also been supporting national and state governments with provision of cold chain infrastructure. These solar panel powered cold chain equipment that we see in certain primary healthcare facilities that we go to in country was facilitated by GRISIT. This is some of the private partnerships that we've seen. And they were hoping that, of course, with these successes and scaling up, we hope to see more private guys coming into the picture. Thank you.
Thank you very much for that. And I really love the fact that everything boils down to ensuring there's availability of those life-saving vaccines at the last mile. I think I'll roll on to the next question with pharmacist Doreen. If you have examples, you can also cite them, but the question goes thus: what are some of the best practices that have emerged from successful public-private partnership in the delivery of vaccines and medicines? Over to you, pharmacist Doreen.
Thank you very much. Before I go on to answer this, I also want to include an example of a successful public-private partnership, which was the USAID MTAPS program to improve access to COVID-19 vaccination through the private health sector, the private hospitals, clinics, and community pharmacies. In looking at the best practices that have emerged from public-private partnership, I would like to talk on this, looking at the work that was done on the USAID MTAPS program. One major best practice was ensuring that a concrete plan was on ground to ensure the success of the partnership. So for every partnership, you have a well laid out plan for the partnership to succeed, and also bringing the different partners involved on the same table. Like when we started the program, we involved both the public and the private from the design stage through the implementation and, of course, the assessment of the success of the program. So having a concrete plan and having a framework, a solid framework for the program to work, it is very, very important. So and also in the implementation, both the public and the private partners coming together to carry out both implementation, monitoring, and also ensuring that different plans are put in place to ensure improvement as the process is going on is another best practice that could be put in place to ensure that the private-public partnership is successful. Thank you.
Thank you very much, Pharmacist Dorian, for that wonderful, for putting it wonderfully. The key takeaway I got from that is collaboration, planning, developing a framework that helps, that brings in the cohesiveness for working together, and monitoring and evaluation. Thank you. Dr. Abiodun, do you want to add to that?
Yes, absolutely. I think just, to put a bit more perspective, I think just repeating a bit of what she said, having clear objectives from the outset about what this is going to achieve, right? And what then would be termed as improvement or success, right? Having that clear transparency in decision-making and funding. And then of course, being flexible, right? Such that it's adaptable to changing circumstances and of course, local contexts, right? And I think the last one, which mostly, most projects have not been put into the perspective before now, is sustainability planning. We need to start looking at developing long-term sustainability plans from the get-go. I think this will also be termed as best practices that will further strengthen successful partnerships.
Thank you very much for that. Clear objective, making sure everyone is clear about what is to be achieved. Flexibility, you don't have to be too rigid because whatever you're doing, you have to look at the local context and ensure that they are able to adapt and adopt whatever you're sharing with them. Sustainability, which is the key. How can we ensure that whatever the public sector is doing is sustainable to the level where you have the private sector today? Moving on to the third question, Dr. Abiodun, how can the public-private partnership be scaled up to meet the increasing demand for vaccines and life-saving medical products? Over.
Okay. So, like we say, if we already have something working, there's no point reinventing the wheels. But for scalability, we need to be able to, take a look at successful models, and then we can replicate them in different regions and countries with similar needs. But of course, it's not going to be copy and paste. It would have to also have, like I said, that local content engagements in the design when we are doing the replication process. We should also be looking at attracting investments. When we demonstrate impact and effectiveness of partnerships, we can use that to drive more private sector investments. Just like I mentioned to you, with the local farmers, when we started out initially, we had just about a handful of them. Now everybody's trying to come into that space because now they've seen this valuable partnership with that. Before now, one of the challenges they had was trust in government because some of them had gotten their fingers burnt, supplied to states, federal government, and haven't been able to get their money up until now. But with these partnerships that we brokered, we ensured that there were clear cost losses that ensure that funding was made available as at when due. So attracting this, when they see successful partnerships, it attracts more investments. Then of course, there has to be that clear government commitment. With everything in the world, private sector usually will invest where the government focuses more. So with the government focus on healthcare, prioritizing public partnerships in healthcare agendas and allocating resources accordingly. This is where resource mobilization becomes very key. If we must, get successes in our programs, and then of course, attract private sector. Then of course, with government commitment also means that they also have to create an enabling environment, right, through supportive policies. regulations that we know protect all parties involved, and of course incentives that encourage private sector engagement in healthcare delivery. So for instance, we're looking at, say, people who want to go into the drone services, because obviously the zipline cannot go across the country, ensuring that getting a licensing, making, the barrier for licensing, lower, some tax break, whatever it is that needs to be done, done at that level. Of course, we also will be looking at international support. International organizations and donors who can provide financial and technical support, to expand successful partnerships. So, donors who've seen that this program has been successful can bring in more funds, so that that's also scaled within the country or, outside, right? And this is key. This is the one that I think that we need to continue to build momentum on, standardizing best practices and creating toolkits, so that when you want to move, you want to replicate, this helps with streamlining the scaling process, and then of course it ensures that there's consistency and efficiency in that program. Last but not the least, adoption of technology. We all know if you must scale, then technology must come into play. Mobile apps, drones, like I mentioned, automated vehicles. We'll get to that point. Telemedicine, quite a lot of them. But of course, technology without any doubts would go a long way in help and scaling. Thank you.
Thank you so much for bringing that to light, because the fact that you mentioned technology, you mentioned enabling environment, that's true government policy, helps us think of how the government would reallocate its resources and also mobilize for resources. This now brings us to the next question, which I think I would hand over to Pharmacist Dorian to handle. How can these partnerships be sustained over a long period to ensure that the continued availability of life-saving medical products, especially within the low-income countries, is sustained strategically? Over to you, Pharmacist Dorian.
Thank you very much. When you talk of sustainability, to be able to have a sustainable public-private partnership, there has to be a very careful construction of appropriate governance mechanism. And also you have to take into consideration conflict of interest procedure, and there must be investment of time to understand stakeholders' perspective and constraint. So it's very important for there to be a sustainable PPP. There has to be a concrete governance mechanism. Let me give an example. When we came in with the Improved Access Program through the private sector, we had to recognize the various stakeholders that we needed to work with. And we didn't want to go like other programs, to go to individual private facilities, because we have seen over time when such is done, that as soon as the program ramps up, the initiative dies. So because of this particular reason, we decided to work with the professional bodies of the various medical professional body. So we're not just working with the facilities, but we ensured that there was a partnership forged between the professional bodies and the state primary healthcare development agency, such that that partnership that has been formed like a governance, a leadership framework for the program in Nigeria. So despite the fact that the program has closed out now, because of that framework that was developed, that program is still ongoing, even without the MTAP support. So it's very, very important that a working mechanism of governance for the partnership is put in place. And secondly, just like Dr. Abiodun said, there needs to be standardization of best practices. You have a standard of all the practices well documented and available for all to see, even in future programs. And also it's important for sustainability, for there to be a building of trust between the public and the private sector. Because one major issue that have risen up over and over again is the mistrust between the public and the private sector. So an avenue to build trust, to ensure that there is a well-built communication framework that allows for openness, open communication between both the public and the private sector. Once this is put in place, you see that it becomes easier for such partnership to be sustainable. And of course, the incentive comes into it, because nobody goes into partnership without having something that benefits them. So we must create a win-win system that both benefit both the public and the private sector. If not, that system certainly won't be sustainable. Thank you.
Thank you very much for putting that nicely. I love the fact that you mentioned that transparency, it's important, openness. And I know this would actually help me roll to the next question, which Dr. Abiodun will be addressing. Technology plays a key role in ensuring that there's transparency in the processes. To ensure that this is sustained and eliminate conflict of interest, Dr. Abiodun, what role do you think technology can play in improving the efficiency and effectiveness of this partnership, especially around reducing the current challenges we're having with zero-dose children? Over to you, Dr. Abiodun.
All right, absolutely. Thank you so much. I think the first place would be for us to look at how we can even begin to gain more insights into some of these situations, you know, and that's where the place of predictive analytics and artificial intelligence comes into play, right? This, if properly deployed, can assist in forecasting vaccine demands, and of course, optimizing supply chain logistics, thereby reducing wastages and stockouts. This would also then support with identifying areas with zero-dose children and enables them to be targeted more with interventions, right? We can also bring it a little bit more home. This is something that is quite familiar. And so we're looking at health techpreneurs who are taking a look into those areas. I know there are a lot of work going on in that space already, but the development of mobile apps, mobile apps that will support health workers in tracking vaccine doses administered and in sending reminders to parents, and this will obviously reduce the incidences of mixed vaccinations. If we take a look at the kind of structure that has been put in place for the COVID vaccine, for instance, where you can go online, check to see when's your next dose, what dose have you collected, the batch number, and all of that. Same thing with our yellow card. So scaling this kind of thing up so that it completely expands that. Of course, we can also, as simple as a SMS message reminding the parents, of the next vaccine where they can't go to get it. We can also use technology for digital mapping. For digital mapping and geographic information systems, which will help identify and target remote communities with low vaccine coverage and ensuring more efficient allocation of resources, right? Where we can also use technology, leveraging the Internet of Things enabled devices, for cold chain monitoring, which we can then use to remotely monitor the temperature and condition of vaccine storage, especially while in transit, so that we ensure that the quality of vaccines are still what they should, are still assured by the time they reach the last mile, right? I mean, of course, we've talked about drones, and I also mentioned earlier the place of the delivery robots, automated vehicles at the best. So we also need to be mindful of some of those hard to reach areas, not really being hard to reach, but sometimes might be some conflicts in those areas. So automated vehicles, eliminates risks on persons. It might just be an asset risk that we'll be facing. But of course, that can also be useful. And of course, last but not least, telemedicine platforms, can be used to connect remote communities with health professionals, so that they're providing guidance and also reducing the need for a physical infrastructure. I mean, these are some of the few ways we can leverage technology to ensure that we're able to improve vaccines and medicines delivery. Thank you.
Thank you very much for that. And I appreciate the fact that you mentioned some things I can really relate with, say for child records, so that child will not be missed. Talking about EHA, we have some technologies, right? And we have things like VATRA, which helps keep record up to date, notifies the parents of the next vaccination. Pharmacist Doreen mentioned earlier about ensuring that this continues, right? When you hand over such things to the government, how would you ensure that it continues? For example, you also mentioned something about monitoring temperature-sensitive items like vaccines while they are in transit. EHA still has a tool called LOMIS. LOMIS Deliver helps track vaccine usage both in transit and at the last mile health facility. It still comes down to people, right? And this will take me to the next question. How can public-private partnership ensure that the needs and preferences of the local communities are taken into account in the delivery of these vaccines? We have, each community in Nigeria is a bit dynamic. They have their peculiarities and they have those issues we face. Pharmacist Doreen, I don't know if you'd be able to add to this, but how can we ensure that it meets the local needs? Whatever public-private partnership we're trying to implement meets the local needs. Over to you.
Thank you very much. When you talk of the local needs, most times what I've realized is partners and government alike actually sit down and design program without actually sitting down to align the needs of the local communities. When it comes to a life-saving medications and also vaccines is a bit peculiar, because vaccines, you're telling people that are healthy to come take this vaccine. So it's easier if somebody is sick, or you go to the hospital because I'm sick, I can't go to work. But for vaccines, you're talking of healthy population. So for most people, they want to be able to access this vaccine, considering the importance to their health. They want to be able to access this vaccine without having to break a bank. That means it must be at a low cost. Cost now is not just about the vaccine being free. Cost is about the person transporting to the point to get the vaccine. And also you want to be able to access it at your convenience without having to miss your regular work. So what I think private partnership can address this issue is by designing programs that makes it flexible for the local community to be able to access their vaccine. That was one of the reasons the private sector were brought into the COVID-19 vaccination, because it offered the flexibility that community. Let me give you an example. A farming community, they leave for the farm very early and they come back very late. By the time they are back, the public health facilities are closed. So that means they can't access the COVID-19 vaccine. But with the private sector coming into the vaccination sphere, it meant even if they want to access their vaccine at 9 p.m., 10 p.m., they can easily walk in there and get it. If they want to access it at weekends, they can get in there and access it. So what we can do is to look at what are the specific needs of this local community and design PPP around these needs to ensure, because if we do that, you're going to see improved uptake of these vaccines. Even for the childhood, the vaccines for the childhood infections, the same thing applies. And also, in looking at that, we also look at the fact that there is need for there to be effective funding. Sufficient funding is very, very important for any private, public-private partnership to work. There must be sufficient funding to keep the process going. The private sector, as we all know, they are for profits, right? And they have some advantage that you can't get from the public sector. Same for the public sector, they have advantages, and also that, so they both bring important things to play. But in a country like Nigeria and other low, it's very important that we have adequate funding for to design effective PPP that will address the local needs of the community. Thank you.
Thank you very much for that. You cited some very good examples, and especially the fact that people that are supposed to take vaccines because of the nature of their, because of their lifestyle, tend to go out in the morning, and by the time they return, the public sector health facilities will have closed. But when we collaborate, when they're able to collaborate with the private sector, they are able to still ensure that people get the doses they need. Then you mentioned that there is the importance of ensuring that the cost is right. Talking about cost, it's interesting that everything we're doing still boils down to cost, right? And these are some of the challenges we're facing. I can see pharmacist Timileyin has finally joined us. Welcome. I think I'll go back to some of the questions, initial questions that I would really love to have your input on. We talked about role of technology in improving efficiency and effectiveness, especially around public-private partnership and reducing zero doses. I know you have a lot to add to that, and I would like to hear from you. Over to you, pharmacist Timileyin.
Okay, thank you, Mr. Adediran. Did I get that? Adeniran.
Yeah, Adeniran.
Yes. And the e-health team. I really appreciate the opportunity to be on this call this afternoon. And I apologize to the audience here for coming here late. I was engaged on another call and it's delayed beyond my expectation. Okay, I think we must have delved into a couple of things before I came. So I would take the chance to assume that whatever I say will probably fit in well to whatever we have discussed. I'm sure I will have a listen to whatever we have said before so that I can also learn and understand. Well, when I was thinking about public-private partnership and then in last mile delivery, the first thing that came to mind is around, so what can we do at the last mile that will not impact heavily on the costs it takes for a patient or a client to access the vaccine. Because all of the examples of public-private partnership that I have, I can point my hands to, especially within Nigeria context, are very effective, but at the same time are very expensive. Okay, maybe let me not use the word expensive, but at least it requires significant financial investment for you to access services in those places. But you can be certain that the quality you get from such facility usually goes above the average you get in either the private sector or the public sector solo, because the public-private has a way of balancing quality and then efficiency using the government and the private sector approaches together. So when we are looking at technology that can be used to enhance public-private partnership at the last mile, I will begin to look at what technology can we use that will be accessible to somebody in UGEP who has limited access to either power or to the technology that we are even talking about. And the first thing that came to mind was the use of mobile. You know, if you check the statistics around Africa, you see that it is ticking up. The availability of mobile phone in different remote areas, it continues to increase year over year. So it tells us that it's one particular part that can be tapped into to build public-private partnership at that level. And when I think about Nigeria, I think about MTN, I think about Glo, I think about all of those telecommunication organization. If they can get to my village somewhere very remote in Kogi State, and why won't vaccines get to those places? And why won't people at those places be able to achieve it? But putting the technology together can be tricky. So that is why that's where the private sector comes into play. There are a couple of things that can be done. The use of WhatsApp alone can be used to manage demand generation. I take an instance of vials that you cannot use for only one person. And if one person comes, you send the person back. You are not certain that the person will be able to come again. So it's a challenge. You're already putting the person at a disadvantage because you are not sure if he or she has the money to come next time. But ahead of time, you can already have a pool of the potential clients for the 10 doses you have in a vial, and then have them come at a specific time. With that, you are building in efficiency in your demand creation, and you're also pulling in the clients at the same time, such that me that is administering the vaccines can administer them within the next 20 minutes instead of staying there for 2 hours and wasting 1 hour. You can do it in 20 minutes and move over to the next thing in live and continue like that. So the use of mobile, and there are a couple of other things that we can use to achieve this even better. Instead of using WhatsApp that requires internet, with partnership with MTN or Glo or all those telecommunication companies, we can have direct messages to tell people that, yes, you are due for this vaccine, immunization, and then you can come at this specific time and manage this scheduling like that, such that people can plan their life. You can quickly run off from work and get it done at the exact time instead of waiting through the whole day before you get vaccinated. That is just an instance. Okay, then when we begin to look at a higher scale, and you're looking at how to engineer integrated system, you may want to invest into something that can help you to optimize your demand. And that's where you begin to think around analytics, data science, and other technologies that you can you can use to manage that process. It may be difficult for government to manage it on their own. So with private partnership, public-private partnership with a private sector that can provide that activity, service, they may not necessarily have to provide video only service that they are providing. They are providing it for other things, for consumer goods, for other sectors. So joining the public sector, health sector, will just be at a marginal cost to them, which is also great, making it affordable for the government and for the people that will eventually get it done. Well, there are a couple of other things that we can talk about, but I do not want to continue to talk into space. I figure that a couple of things have been discussed here. There are other technology like blockchain that can be used to enhance quality and enhance contractual process, like even the public-private partnership that we're talking about can be managed on using a blockchain technology such that transparency and accountability can be enhanced without so much hitch. I'm checking time and I do not want to take so much time. Thank you very much.
Thank you very much for that. And you've actually touched on every pain point we've discussed. So with all what you've mentioned hard to reach, you've mentioned funding. I'll roll on to the last question. How can this partnership address the challenges such as inadequate infrastructure, limited funding, difficulty in reaching remote communities? You mentioned technology, but there are communities that still do not have, or they have little penetration of internet. Say, for example, you need data for them to do proper reporting. Which other means can you adopt, and how can this help cushion the whole effect of, to address the current challenges? Let me put it that way.
So the word I picked from pharmacist Dorian at the time I joined was cost. And you re-emphasized it as you were passing the baton to me. So I don't think we can talk around all of these issues without considering costs. It's critical because when I think about a remote setting where some of these technologies might not be available, you realize that we already have evidences that drone technology can penetrate very hard to reach zones. They don't just penetrate and deliver commodities. They also penetrate and generate data. That is the more interesting thing for me as per the drone technology. Once it goes into a place that maybe you and I cannot go because we cannot drive in there or we cannot use horse to get there. Once the drone gets there, you can engineer the drone to sufficiently gather the necessary data you need to bring back to you. And then it can also inform your next supply. But when you look at it at the last mile, independent of the central coordination, it will be so scary for you that you will drop it as a first thought. But when we aggregate the needs from the different last mile, from all the different last mile, and at the center, you can assume a pool demand and then quantify the benefits that you will gain by investing in such drone technology to achieve that. I was listening to a particular documentary yesterday, and we're talking because I have been a proponent of using drone to deliver commodities, but I have always been very critical about the cost of drone. But when you check the cost of drone over the last 10 years, it has significantly come down. And we are now seeing evidence that when you make that the investment in drone technology is upfront. When you make it upfront, by the time you go down the line in 5-10 years, the benefits will eventually outweigh the investment. You'll begin to see the return investment. So we have to be long-term. We have to have long-term mindset when we are investing in that kind of things, and that is a way to address funding. That's a way to address funding. Then other ways that we can address funding, I had mentioned a part of it, is that service is delivered by a particular private company, private sector, so several other customers. They are not just delivering that service to us. We will look for a way in which the service that we are requesting for fits perfectly into a service that the private sector is already providing for other private sector or other government sector that they are already taking responsibility for financing such model. For instance, we have the PLM, the Project Last Mile. Project Last Mile, you know, is a public-private partnership between the multinational agencies, international agencies, and the Coca-Cola. Coca-Cola is already delivering commodities to the remotest of places. So the idea is to begin to leverage on what Coca-Cola does to deliver Coke to the remotest of village. And you're surprised that you will find cold and chilled Coke to take wherever, even when there's no power supply. So we can already leverage on that. They will deliver Coke anyway. So delivering a pack of vaccine will not come at such an extravagant cost. So if we do that, all we need to do is to tweak the condition and see what can be adjusted in the condition that delivers the Coke to add a box of vaccine that will deliver to sub-villages. With that, we will have reduced the cost of delivery to the last mile significantly. 4 minutes to go. Thank you.
Thank you very much for that. You've touched on most of the things we discussed earlier before you joined. Thank you so much. I would just want us to wrap it up 1 minute, just your final words from pharmacist Doreen and Dr. Abiodun Oyenuga. Just give us 1 minute before we move to the questions section so that we can go through some of the questions on the platform. I would start with Dr. Abiodun.
Okay, thank you so much for
1 minute. Thank you.
Yeah, for that opportunity. And of course, for the insights from Timmy, great insights. Thank you so much for your contribution. I think the only thing I just want to add is that as we begin to look at public-private partnerships, especially with improving healthcare delivery, and this is not just about, the focus on vaccine right now. We're talking about, global healthcare as a whole. We should be a lot more. We should look at developing products that address real challenges at locally, and of course, this will involve, local context engagement. This is one of the reasons why most supports have failed. Like pharmacist Doreen mentioned, some people sit somewhere in an office, develop something for a strategy that's supposed to, without really involving. So it's ensuring that there's that local context involvement at all levels, ensuring building capacity to ensure that beyond, whatever support, especially from donors, there's that tendency that it can be carried over. Thank you.
Thank you very much for that. Local support. Pharmacist Doreen, 1 minute. Give us your final words, few take home for us to really go back and think about.
Thank you very much. I just want to say that public-private partnership is the way to go. That when properly designed and executed, they can create social value through on the time and on cost delivery. That has been proven over time. And also it helps in generating efficiency gains and offering innovation in project design. And it's also an avenue to incorporate global best practices and provides a means for accessing new capital. So it's something that we should hold on to, and we should not consider the failings of past PPP but we should look at how best we can design PPP program to deliver on what they were meant to deliver on. Thank you.
Thank you very much for dropping those gems. It's important. Partnership works, public-private partnership works. And I believe all the audience have learned today. We'll be moving on to the question and answer session. And I'll thank the audience for staying with us. And I believe we have all learned from the professionals that spoke. We'll be looking at the questions. Please, if we did not look at your question, it's not intentional. It's because time, they say, is always fleeting. So let's take some time to look at some questions. I can't find any question on the Q&A. Did people drop them in the chat box? Okay, so it seems. Okay, there's a question on LinkedIn. I would like to learn about data reporting in a PPP. If private sector should keep their data or report it to national data system. That question is from Luke Kranger from Liberia. So I think he's talking about where would the data, when you have a PPP, where would the data be domiciled? Is it with the government or the people? Dr. Abiodun, could you please answer this question for us? Yeah.
Absolutely. So who keeps this data? Remember, it's a partnership. Everyone should have access to this data. So the data is really very key, especially to inform governments on how much more they need to, invest in this partnership. Also guides the private sector participants or players, to know exactly how they can strengthen or, improve on the opportunities that they have available. See, I think one thing that I also need to mention here is investments from private sector is not charity. We need to be clear about that from the outset. It's a business case for them. And so in a bid to also ensure that, they get more from that investment, they need this data, to drive, more decision making. I mentioned earlier about research and development. This is where data comes in. This data that they collect during the course of this partnership helps them to identify where else are those opportunities or what opportunities exist within the current program that they can improve on that will help them, expand some of their offerings. And then of course, maybe also bring in more private sector partnership or funding. So the private sector should not keep the data to themselves. Like I said, it's a partnership. It must be shared with the government because the government needs it to make some of those decisions too. Thank you.
Thank you very much, Dr. Abiodun, for that. Well, we're out of time. I would say thank you for being part of the 15th episode of the Insight webinar. Time, they say, flies when you're having fun. I guess time, they say, flies in this case when you're learning. I believe we have gained so much from the wealth of experience of our panelists today. Don't forget to follow us on our social media handles for more insightful information. I would like to appreciate each and every one of you for joining us and see you on the next webinar. Bye, everyone.